and 495 diagnosed in Mobile County. Among those, we have 17 reported deaths, and among those 17, we have 12 that have been classified of dying with COVID-19 illness. So we have a couple of statements from our health officer. So today, comment was based on data. It appears that our social distancing is having an impact, but in the middle of the battle is not the time to let down our guard, or we will be overcome. So again, really important that you continue to adhere to the stay-at-home order, that you comply with local quarantine directions and curfews and local ordinances. Also, remember, when you do have to go about for essential activities, we want you to be wearing a face covering. This is the face covering I showed yesterday. This was mine. Thanks again, Holly, my coworker who made this. So to properly wear this, I'm going to put it around my ears. Well, my hair's in the way. And again, remember, it needs to cover over the nose and below the chin to get a nice snug fit. So if you're out and about buying groceries or getting pharmaceuticals or medical supplies, or if you're visiting a relative to take them food, those essential functions, you need to be wearing one of these, and please wear it properly to help protect our community. Again, the face mask is to protect others from the germs that you may be spreading. So please, even if you think, I would survive COVID, I don't need to protect myself, when you wear this mask, you are potentially protecting others from the germs that you are spreading out in the community. So please do your part and wear your mask or your bandana, your scarf, whatever it takes when you have to be out and about the community. I've also been asked about how to take off gloves. So in general, we don't recommend wearing gloves if you're just out and about in the community. That's when you should be hand washing and disinfecting surfaces. But if you have a family member that's sick, that you're taking care of them, or if you're disinfecting a bathroom or something like that, you might want to use a pair of gloves. They don't always have to be a medical type glove like this, maybe even just a cleaning glove, those yellow ones, that you sometimes see your grandparents wear when they were cleaning your sink. So in order to remove the gloves, pinch it and pull from the inside out, and then use your finger to pull the other one off, and then these go in the trash. So one-time use, put them in the trash when you're done. If you've been caring for a patient with COVID symptoms, or if you're disinfecting an area where a COVID patient has been treated. Let's see, have a whole stack of questions here that I will try to get to. It seemed like folks were appreciative that we published the map showing by zip code the general density of the number of cases throughout Mobile County. Even though we can't give the exact number, this gives you a really good idea about where COVID transmission is occurring in your community. We also have been reporting on deaths and hospitalizations, and as Dr. Harris mentioned today in the 11 o'clock briefing with the governor, we do continue to see older Blacks with underlying conditions disproportionately affected, but we are starting to see some balance. So among the hospitalizations, we're reporting 52 hospitalizations. 31 of those were male, 21 female, 37 were African American, and 15 were white. And among the 12 patients who died with COVID illness today, they're between the ages of 52 and 83. 10 were male, 2 female. 8 were African American, and 4 were white. The important thing is that unfortunately, these folks who succumbed to COVID illness, they had underlying medical condition, they developed symptoms consistent with COVID, were hospitalized, and were hospitalized at the time of death. And I read these statistics because, in the weeks prior, we've been saying, studies show that those folks that are most vulnerable to complications and severe illness from COVID are older, 65 and older, or have underlying medical conditions like diabetes, hypertension, immunosuppressive conditions. And in the beginning, when I would talk about that, it seemed it was data maybe from China or from Italy or from other parts of the United States, but these data are from right here in our community. So People who are at greatest risk of complications, 65 and older, or who have underlying medical conditions, really need to continue being vigilant about staying at home, isolating yourself from sick people, so staying away from sick people, making sure that you monitor your symptoms and that you seek health care if you experience any complications that would require hospitalized care. So again, this information is being shared with you so that we can help everyone recognize that there's still a long way to go in overcoming this epidemic. All right, on to the questions. We had a question, I think, from a Facebook viewer: can mosquitoes transmit COVID-19? And the short answer is there are no data to suggest that COVID-19 can be spread through mosquitoes. Again, the virus, it's a virus that causes COVID-19. But Paul Eford, our Mobile County entomologist, gave me quite a lengthy history lesson and biology lesson about why mosquitoes likely or don't carry COVID virus. And, you know, they can carry a number of viruses, but it's unlikely they would be able to transmit COVID-19. Coronaviruses are generally identified with colds, so person-to-person spread of different coronaviruses, similar to the ones that cause SARS and MERS and now cause the novel coronavirus or COVID-19 illness. But we do have coronaviruses that just cause the common cold every year. So they're generally spread through direct contact of the virus with mucous membranes of the eyes, nose, and mouth. And that's why we tell you, when you're touching surfaces, do not touch your face, wash your hand frequently, so that if you touch a surface that has living virus on it, you keep it out of your eyes, nose, and mouth. So really need to continue to stress the need for good hygiene and frequent sanitizing surfaces and washing hands. Let's see, there's some more information here. We're going to be keeping a close eye on our mosquito-borne illness, as we do every year, and we'll have some news for you soon about when mosquito abatement, mosquito reduction activities will begin around Mobile County, because we know that that's an important service to our community. Right, here's another one: is COVID-19 in the air? The answer to that question is a little bit more complex than it was a few weeks ago. The virus that causes COVID-19 is spread on respiratory droplets. These are very small particles of water, and generally they are too heavy to survive in the air for very long or travel very far. So under normal conditions, the respiratory droplet can travel no more than a couple of feet and then will fall out of the air within, a very short period of time, probably seconds to minutes. Some information that has been coming out lately about viruses like coronavirus indicate that when someone coughs really loudly or coughs really hard or sneezes, or if they're talking loudly or singing loudly, they may be able to expel those droplets much further than we thought. And then in some hospital settings, there have been some data to suggest that it can linger in the air on these really, really small droplets longer than anyone suspected. So those are some of the reasons behind recommending that we continue to social distance, but also wear a mask when you're out in public, because if I'm infected but I don't know it yet, this mask can keep that gaseous air close to me and away from other people. So again, that's part of the recommendation. Also part of the recommendation is some new information that we've learned recently, that people can shed virus when they are either asymptomatic or do not have symptoms, or if it's just before they become sick, or we call that pre-symptomatic. So that's also something new that we learned about the virus. All right, next question. So I have gotten lots of information that something I said yesterday inflamed some folks. So I just want to revisit that subject. Again, we want to make sure everyone is adhering to the stay-at-home order, to non-essential business closures, to staying at home if you are in those categories of non-essential businesses. We don't want you moving about the community unless it's for essential things like buying groceries or getting medical supplies, or maybe taking care of a family member. This is really important because we're all starting to get a little restless. I'm hearing that parents are struggling, to help their kids carry out their at-home schoolwork. Couples are isolated together at home that maybe worked apart and are getting on each other's nerves a little bit. So we're just now coming into what we think is going to be the highest point of the outbreak. We need you to stay at home and follow those orders to try to continue mitigating the outbreak. We think we've slowed the spread. It's really difficult to tell that when you're in the middle of it, but for at least the next 7 to 14 days, we may just now be reaching the peak of the outbreak. So it's really important that you do everything that you can do to slow spread, because again, if we don't slow spread, then we may overwhelm our healthcare system with people who have severe complications and potentially deaths. So that's the reason, again, for the measures is to try to flatten the curve or slow the spread so that we can keep our hospital doors open and our beds not overwhelmed with patients. So apologies if I offended anybody yesterday. We'll just continue to impress upon you the importance of those social distancing measures. All right, here's another couple of questions. And James, if you see anything queuing on Facebook, let me know. Mm-hmm. Let's see, that one I already answered. We think that early signs are that social distancing is having an impact in flattening the curve. A question about the number of deaths in Mobile County. The number of deaths per capita in Mobile is not that different from Jefferson County. It's very difficult for us to compare ourselves to other counties because our makeup is much different. But the rate, or what we consider the incidence of disease, the number of cases divided by the total number of population, is very similar to our Jefferson County counterparts, and the number of deaths does not look that different. We will continue to keep a close eye on it. Again, we know that deaths are occurring in those that have those highest risk factors for complications, so older and underlying health conditions. Okay, someone's asking about that we have children that are impacted. Yes, we're reporting 4 COVID-19 cases among children that are 0 to 4 years old. It's been described nationally that there is COVID-19 disease in children. They appear to be less impacted, so their symptoms are somewhat different. They usually do not require hospitalization. The illness is usually milder than our older population, and because of this, most of them are able to, endure or recover from their illness at home. See, how is it determined with healthcare workers can come back to work after exposure? We heard 2 negative tests in a row. So there are a couple of subtleties in this question that I'll try to explain. Exposure would not necessarily require 2 negative tests to come back to work. A patient or an individual who is thought to be exposed, so they were within 6 feet for 15 minutes or more of a laboratory confirmed case, that individual will be required to quarantine at home for 14 days and self-monitor for symptoms. If a patient tests positive, if they have laboratory confirmed COVID, if they're symptomatic, CDC says that once they are fever-free for 3 days and it's been at least 7 days past their first symptom onset, they can be removed from isolation, or you can lift those precautions. But the state health officer ordered that anyone with a positive laboratory test, that they be quarantined for 14 days past their positive test result. This is to try and prevent people who test positive but don't have symptoms from circulating around the community where they might be inadvertently spreading germs to other people. So it's a little complex. So hopefully that answers those questions about how you can lift isolation and lift quarantine for healthcare workers and any individuals. All right. I've gotten lots of questions today about cluster investigations, particularly in healthcare settings. And yes, we have investigations ongoing in several healthcare settings, whether they be hospitals or long-term care facilities or rehab facilities or nursing homes or specialty care areas or detention centers or classrooms. So yes, we have several cluster investigations going on, but the Mobile County Health Department will not be identifying individual facilities who have residents or healthcare workers or visitors at those facilities that have tested positive for COVID-19. Very early in the outbreak, some local hospitals would make announcements about when they had a positive resident or a patient. And if the facility decides to make that announcement, that is totally up to them. But we at the Mobile County Health Department will not be releasing that information. And Montgomery, the Alabama Department of Public Health, will not be able to provide that to you either. So please just know that we know we have COVID disease in a lot of healthcare facilities. We know we have COVID disease in at least almost 500 households, so it's out there. And so to continue to try to ask us to comment on specifically on an agency or a facility or a hospital, we can't do that, and it's really not helpful to our ongoing investigation to try to help those folks mitigate what's going on in their facility. So thank you for your patience on that. And I believe that is all I have for today. James, do you have anything on Facebook? All right, James is shaking his head no, so I guess that means there are no questions today. As we always do, we'll take a look and as the hours go by and see what other questions you have. And anyone from the news media or the print media can contact our public information officer with their questions, and we'll try to answer those. If I can't answer those by email, I'll certainly try to touch on them during the 2:30 update. So thank you, and we'll talk to you tomorrow.
Thanks for joining us here on Fox 10 News. I'm Chelsea Sayasan. Now, we just heard from Dr. Rendy Murphy with the Mobile County Health Department. She explained that social distancing in the city of Mobile and the state of Alabama is starting to make a difference. She reminded us to wear those face coverings when performing essential tasks. Now, Dr. Murphy says that State Health Officer Dr. Scott Harris explained we are starting to see a lot of older African Americans with underlying health issues contract COVID-19. She says those numbers compared with other demographics is starting to level out. She also demonstrated how to properly take off a glove after use. Now, you can watch this press conference in its entirety on our Fox 10 YouTube page and Facebook page. You'll want to stay close because we're bringing you Mayor Sandy Stimpson at 3 p.m. We may find out more about potentially reducing that capacity limit in big box stores and grocery stores. We'll be right back at 3 p.m.